Um, some of the really valuable thing to know is just like many people don't even know what their options are. And so when it comes to growing a family, there are so many options. We can just do an assessment, see where someone's status is. We have all kinds of potential treatments available, whether it's inducing ovulation, so making you have an egg freezing, embryo freezing, so that you can think about bearing children down the road. We can do artificial insemination, which is known as IUI or intrauterine insemination. We can do in vitro fertilization. For people who are struggling, we can talk about donor eggs, donor sperm, gestational carriers. We do genetic screening, genetic testing. And so those are like all of the fertility options that are out there. I saw in the chat, somebody said, how do I get pregnant at age 43? Well, the first thing to do is find out some information about you, because each person's journey and what they need to do to help conceive is going to be different. And so I would recommend, starting out with an assessment. But at Kindbody, it's not just about fertility. It is about the entire person. So we also have services in gynecology where we can do someone's full woman checkup. We can do urgent GYN care for those who aren't trying to get pregnant ever or not trying to get pregnant right now. We have the options of, contraception, anything that has to do with GYN, whether it's polycystic ovary syndrome, endometriosis, fibroids, preconception counseling. And then we also want to remember it's not just about what's between the belly button and the knees. We have full holistic services. We can take care of people who are in non-traditional male, female, two people binary relationships. We can take care of the entire LGBTQ services. We work with donors for and surrogacy agencies. We do total body wellness and nutrition for people who might need to think about how they're exercising, how they're eating, and that's going to impact their overall health and fertility. Today, we're going to spend a fair amount of time talking about the emotional health support that's available. We have some Eastern medicine options for people who are interested in doing some complementary services like acupuncture. And we're even now doing maternity and postpartum care. So I always tell people knowing where you stand is a great place to start. Knowing where you're going is a good place to be. And so I'm going to turn this back to Dr. Mayer so she can talk about kind of how important it is and how empowered you can feel just by knowing where you are today and what your potential options are.
Okay, so basically the first thing that anybody should do when they're considering, regardless of where you are in your journey, is to have a fertility assessment done. And that is a visit that involves us tailoring our workup and discussion and planning to your situation. So the first thing that you will do, depending on where you are coming in, is you'll have a consultation with a fertility specialist. You can do that virtually if that makes more sense for you, or you can also do it in our clinic face-to-face. And in that consultation, we'll talk about what are your goals? How many kids do you want to have? When do you want to have your first child? When do you want to have your last child? Have you really thought about that? And what are some questions that you need to ask yourself to be able to answer those questions? And then we'll also talk about, are you partnered out now? Do you have an egg source? Do you have a sperm source? And where might those sources be? And then also talking about your medical situation, any medical issues that you've had, any surgeries you've had, and your gynecologic history, that sort of thing. We do a pretty thorough overview of your entire history in that visit. And then you will also get an ultrasound, which is an internal ultrasound that will look at both what your uterus looks like and what your ovaries look like. And in looking at the ovaries, we can do a count of the follicles, which are the eggs that are starting to develop in your ovary for that month and are being recruited. And then we can also do blood work something called anti-Müllerian hormone, or AMH, which gives us a sense of where your ovarian reserve is, because all people with ovaries start with all the eggs they're ever going to have in their life, and over time the number decreases until they go into menopause, but that trajectory for every person is different. And so us getting a count of your antral follicle count with ultrasound and getting an AMH, those two things together can really help us counsel you on where are you with your ovarian reserve and what does that mean for your future fertility planning goals. And then if you are partnered with someone who produces semen and you want to have babies with that person, if you're having trouble getting pregnant with that person, we can do a semen analysis as well. And then there's some other, depending on if you're currently trying to get pregnant and having trouble, or if you just want to talk about your goals, we'll plan other assessments to get us more information. And from there, we can talk about what your options are moving forward and how to plan for your future family.
Dr. Henny, you're on mute. Let me get you. I think I can unmute you. I won't click your button. I think you're like, it's like when you're trying to open a car door and someone keeps locking it on you. Can you unmute? No. Okay. Oh goodness, why is this happening?
Now I can. You had to give me permission. Tracy had me blocked. She was trying to keep me cute and keep me muted. So I just wanted to sort of jump in with what Dr. Mayer was saying, because I think gathering the information is really empowering, but it's also really scary because you just don't know what that information is going to reveal. And sometimes the information is not what you expected to hear or not what you wanted to hear. And so it takes time to process that information. And so this is a really great time. I think it's one of the points it's just stressful for people when they're coming in for trying to learn about the results. And so I sort of like to, ask Maya Grobo or even Liz Kelly from Talkspace if they have like tips and pointers on how you should be thinking about processing the new information that you may be getting.
Oh no, it's the mute tragedy. No. Let me get you. Oh wait, if I can make it, sorry guys. Liz, you should be able to unmute now, in theory.
Okay, I think I'm okay.
Okay, there we go.
Trying to mute me, Tracy.
I know. Everyone's blaming me. I know. Blame me. I know.
So I don't know, Liz, maybe I can start. Well, I just want to start. I'm Maya. I'm a California-based licensed clinical social worker with Kindbody. And I just have to say, just listening to the doctors and watching this presentation, I feel a little bit emotional almost, having been a patient from 2010 to 2015. So, it's just such a different approach and a different understanding that infertility isn't just a medical diagnosis. And that's what both of the doctors here are saying, and that I know all the Kindbody doctors, Dr. Brower in LA, I know, and she takes the same approach and understands that infertility really isn't a medical diagnosis only. It's an emotional and psychological experience. It's a relational experience. It's a financial experience. And it puts people into this moment of crisis a lot of times because it is totally unexpected for a lot of people. It's very different if there is a medical condition, and I have worked with people who, had, unfortunately cancer early on, or, they sort of knew that they were going to have some challenges. Nevertheless, that's still obviously devastating. But for the majority of people who learn about fertility challenges that aren't expecting it, it can really destabilize everything and challenge everything from your religion to your sort of beliefs and to your feelings about yourself and to your reasons for being, and all of these things. So it's just been, it's wonderful to see that you're delivering this information and you are giving people this front end information so that they can make the best decisions that they can for themselves as they move through this process. But in terms of tips and pointers, which I think is the question, I don't know if there's something else you want me specifically to address, Tracy, or anything, but I just think it's understanding that all of a sudden when you learn about your fertility and you get unexpected news, I think for a lot of people it's extremely shocking, and there's a process of grief that people go through. And I think infertility and fertility treatments, there are just so many layers of loss and grief, and that's why that depression statistic is so high, right? We started with sharing that 90% of people feel a sense of depression, and that's not always necessarily clinical depression. Depression, it can take a lot of different shades, and anxiety also is kind of depression's cousin. I don't know, like just very connected, that feeling of, is this ever going to happen? Wait a minute, this isn't how it's supposed to happen, right? And all of these feelings, but loss is such a big theme in all of this, and not just, the obvious with reproductive loss, but the loss of being able to get pregnant in the privacy of your own home, or the loss of a dreamed future, the loss of connection to your partner, to your own body, to your peer group, genetic loss when people move to donor conception or surrogacy, the loss of being able to carry. So I think mental health challenges, whether it's depression, anxiety, or other, really are just really prevalent and understandable. And so I think the biggest tip is to be able to understand that you're not alone in it, and that you don't have to be alone in it, and to be able to seek support in whatever way feels right for you. And that's why I think it's really nice that actually Kindbody has talk spaces. Yes. Because it's a different approach, right? And so it's really looking at what approach is going to work best, right? So but I think that one of the biggest tips is just being able to zoom the lens back a little bit, which is what I work with my clients a lot, because everything feels so intense, and all of a sudden every waking minute is spent on fertility and what happens next, and what if this doesn't happen, what's plan A, B, C, D, and all these things. And sometimes just being able to zoom the lens out and contain some of the feelings in some ways. Obviously they're very typical coping tools, and being able to exercise and watch funny movies, like all these things. A lot of times when you're in the process of fertility treatment, you can't do some of those typical, I work with a lot of people like, usually I go for a run, but the doctor says I can't go for a run. And, and so it's really thinking about, what can I do to feel connected to other people? And sometimes that's a support group. Sometimes that's being heard by a therapist. Sometimes that's, finding friends that understand you. Yeah, I mean, there are just, I think just the biggest piece is knowing that there are supports out there, and just figuring out what is it that you need in order to get through this specific point in time, and remembering that it's not going to be like this forever. That was my mantra for a really long time. I was like, I'm not going to be going through this in 10 years. Like, and the first it was like, I'm not going to do this for 2 years. But once I passed that mark, I was like, all right, I gotta reframe this, and, kind of expand it a little bit. Anyways, I feel like I'm talking too much. Liz, feel free to jump in if Tracy will allow it.
Oh, looks like I'm able to chime in, which is I was able to unmute myself, which is great. So I absolutely second everything that Maya said. I really appreciate what you said about loss, that, oftentimes we have expectations of what our life is going to look like. And when our expectations aren't met, that can be extremely devastating. One of the suggestions I have is that there's so many different emotions that occur. So it's really important to just be able to accept those emotions that you feel. One of my favorite authors, he's a neuropsychiatrist, Dr. Daniel Siegel. He has this famous line called "Name it to tame it." So if you can name your emotion, oftentimes it lessens the power that it has over you. So really try to check in with yourself and name what you're feeling, and let yourself feel it without judgment. You know, oftentimes with my clients, I find that they feel something like, but then they shame themselves for feeling a certain way, like I need to look on the bright side, or I need to do this or that, or I shouldn't feel this way. But it's okay. Whatever is coming up for you, name it and feel it. My other suggestion is to really focus on what's in your control, because when you're going through the infertility journey, it feels so many things feel out of your control, and so many things feel uncertain. So to really, work with your support system, whether that's a therapist, a partner, friends, to identify what things are still in your control. What can you do to make things just a tiny bit better for yourself, and to get yourself through this journey. But again, I second everything that Maya said.
Something you said, Liz, that really resonated when we ran through and kind of put together the run of show was utilizing processing as a way to maintain connectivity to the journey. And that to me really resonated, because I think as you go through this journey, you're here, you're there, you're trying, and how do you be present? And I think part of utilizing processing helps keep you connected. And then really is every person is different. If yours is doing a conga line in your backyard or whatever it is to help you process the crappy things that happened at your appointment, then do it. So there is no right way to process, but really find what that is for you. And Maya and I have wonderful ways of processing, which is usually funny gifts back and forth when we like to process together. But I really do, that resonated so much with me, that really one, to keep that connectivity to the journey by processing and being present, and then finding what works most for you.
So I like what Tracy was saying about, it's like she and Maya do some processing together. And I feel like when you're going through this journey, it's important to realize you're not alone in this. And, not to minimize what anyone's experience is, but truly 1 in 8 couples will be going through a fertility journey at some point in their relationship. And that doesn't even count the people who are, non-traditional couples, the people who are single, who are trying to go through a fertility journey. And so it's important to maintain, I think, a connectivity, with other people, and figure out and gather your support system around you. So that support system can be, friends, family, but sometimes you might want to go outside of the people that and sort of build the village, build your support systems. You're going to be creating a life, hopefully. And so you can also create a structure and community for that life to join. And so I always, there's professionals, there's peers, people who are going through the journey, but there's the entire community that's out there and available to you. There's some free resources like Resolve, which is a fertility advocacy organization. You can find them online, and they have some support groups. I'm also curious to know what Maya and Liz, who they have suggested that people might find as part of their community. And even, people that have gone through this, I would love to hear what other people have done to sort of build their community, to help them connect as they're going through this, and to remember that it's, this whole process is bigger than them. So, put things in the chat. Maybe somebody else can learn from what your experience has been. And I'd be curious to hear what Maya and Liz's experiences have been also, and what they've recommended to people.
Yeah, the village is really important here. And I think a lot of times when people go through infertility and various treatments, and sometimes they feel like they lose their core village because everyone else seems to be getting pregnant, or they don't feel comfortable, or they're being misunderstood, or people don't comment correctly, or their family doesn't understand, right? So I think it really is seeking a community, whether it's online. I know a lot of people find support online in different ways. So Resolve is doing support groups, I believe, that are free or, low cost. And I think most things are virtual. Kindbody has a lot of different resources too, it seems like, for things like that. I think also everything doesn't have to be fertility related, right? And so like I worked with somebody and she was a hiker, and so she joined a hiking group that, this, because she could be outside was one of it, because it was pandemic. It's a little different now when, it's a little bit harder to connect sometimes, but just being able to go with people who didn't know her story, and that felt really good. I personally, when I was going through it, my acupuncturist became my therapist slash best buddy. And sometimes just somebody who can hold that space for you becomes really, really important. And also, I got trained as a yoga teacher at one point during my journey when I was able to do that stuff. And I think being able to connect to your body again is really important for some people. I mean, it's sometimes it feels like you have this abusive relationship with your body. You're injecting stuff into yourself. I think people often gain weight, during the process a little bit, and don't feel comfortable in their body sometimes. And so finding a way to connect to either professionals, peers, community, yourself in a new way, I think all of those things can be really helpful.
I also wanted to mention, social media can actually be, I know it's a little bit of a double-edged sword. Social media can be an incredibly painful trigger at times, but I also think that you can use things like YouTube and social media and Instagram in a very intentional way to find sources of support. I know when I personally was going through my infertility journey, I found incredible stories of women going through treatments on YouTube, and so I would watch these and hear about these stories. So you may want to think about being very intentional about what social media you consume, and find and really seek out sources that are positive and helpful.
Did we mute Dr. Henny again? Oh my goodness. Sam, can you unmute Dr. Henny? I'm so sorry. I promise it's not me. Maya, I can see you blaming me. I see some judgment. I see some judgment in those eyes. And I think I want to add to what Liz said 100% is it is that like fine line of not utilizing Dr. Google for the bad things to go down the rabbit hole. I personally joined a Facebook group for other infertility warriors. And we had moments of, there are those moments where you're in the rabbit hole and no one else but us rabbits can really support each other. So I do think that there are moments. And I also see the beauty of what Maya said of like putting on your hiking shoes and being in a group and moving your body where nobody knows your story. And you don't have to say the word trigger shot to trigger anybody in the near vicinity.
I just wanted to echo that I really liked what Maya said about reconnecting with your body and how it seems like you're in an abusive relationship. People who are going through this journey often feel like their body has betrayed them. Nobody played house as a small child and thought about going through a fertility journey as part of their fantasies when they were a child, and no one expected or wanted to do this when they grew up. And then when you find yourself in the situation where you are having to go through this to grow that family that you dreamed of, it feels like your body cheated you. And so I love the idea of, like the yoga or the hiking and reconnecting with your body, because you need to get that love relationship back and not feel so betrayed, because that's kind of, what we're here to help you with. And so I thought that was just a really great point to bring out. I'm kind of going to change, we talked about how to connect with people and connect with our body, but now let's sort of like drill down a little bit into like certain times that are super, super stressful within this journey. I think one of the most stressful times is even just that first step of going into the office the first time to say, what's going on? I have patients who come see me, they don't necessarily have infertility, but they just want to know what their status is, and they're anxious and they're scared just to know where they are today, because they're anxious and scared because they saw someone go through this journey and they don't want to have to go through it themselves. Getting the results back and talking about the plan is a really, really stressful day because you're scared. What am I going to be told today? What are the options, and am I going to be okay with those options? When people decide, take that big step to start treatment, there's stressors like the very first day, Tracy said, oh, the trigger shot is a triggering word. But the first day that you're taking injections and you go home and you get this huge package of shots and needles and syringes and medications, and you're like, oh my gosh, what am I going to do with this? And you're like, you want me to put a needle in my body, and I've never done this before, and we tell you to go home and do it. So that's really, really scary. Throughout the stimulation process, every time you're like, how many follicles do I have today? What's this mean? There's the night before the egg retrieval, you're like, what am I going to expect tomorrow? This is a procedure. And my thing that I tell all of my patients, I think the hardest part of the entire journey is the waiting game. There's 10 to 14 days after ovulation or after an IUI or after an embryo transfer, and you're like, am I pregnant or not? I've been working so hard for this. So those are the things that I, as the physician on my side, see as the super stressful times. But I'm curious to hear what other people find your stressful times, because maybe what I'm thinking is stressful, other people are like, oh no, there was another day that was way worse than that. So if you have other times that you think are stressful, I'd love to hear what those are. I'd like, what are the hard moments? Is it the waiting game? Is it the first day of shots? Is it something that's completely different that I haven't really thought of? Because, I'm not in that relationship with that person as at their home in their thoughts. And so for everybody, it's going to be a little different. So I'm always curious as to where people's thoughts are. I see a comment in there. Numbers, cost, mixing the medications, wondering if you're doing it right. Processing the results. Oh, I love this one, stressing about trying not to stress. I am a stressed person. If someone tells me, don't worry about it, it's going to be fine, I'm going to stress out about how much I'm stressing out. And so that's a great one. I really love seeing some of these comments that are coming up here. These are really great points to think about. So with all of these stress points that are involved, Liz, do you have any ideas on what people can do to try and minimize those stress points at those, various different times? And then after Liz, maybe Maya can give us some ideas as well.
Sure, absolutely. One of the things I recommend for these particular stressors, these acute stressors that come along is mindfulness. And I know mindfulness sometimes is a little bit of a confusing word. It conjures up images of like people meditating on mountaintops, but really what mindfulness is being fully present in the moment. So, oftentimes I talk with my clients that, about how a lot of, depression is about, regrets about the past, and anxiety stems from concerns about the future. So really trying to ground yourself in the present moment can be helpful for managing the stress you're under. And there's a few different ways you can do that. One is through mindful breathing. And if you'd like, I could lead everyone through a mindful breathing exercise right now, if that's okay with everyone. So everyone get comfortable in their seats. You can keep your eyes open. You can keep them closed. Just try to kind of sit up nice and straight and tall. And this particular exercise is called square breathing. And the reason I like it is because it's pretty easy to remember. And the combination of counting helps you kind of be in the moment and slow down your breathing. So the goal is to consciously slow down your breathing, because when we get anxious or stressed, our rate of respiration increases, our heart starts beating faster, we might start getting a little sweaty and hold muscle tension. And so mindful breathing, what it does is it sends a signal to the brain that you're okay, you're safe. And so it signals the body that it's okay to bring down your stress level. So let's give square breathing a try. So I want everybody to take a nice, slow, deep breath in through their nose, hold, 1, 2, 3, or so, I'm sorry. So breathe in, 1, 2, 3, 4, hold, 1, 2, 3, 4, breathe out, 1, 2, 3, 4, hold, 1, 2, 3, 4. And let's try that one more time. So take a nice deep breath in through your nose. You want your belly and your chest to expand. So breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Breathe out, 1, 2, 3, 4. And hold, 1, 2, 3, 4. And the reason they call it square breathing is because like it kind of makes a square 4, 4, 4. So that's one breathing exercise. Another tip that I like to give to clients are using grounding strategies. If they are, for example, if they are in the waiting room and their anxiety is really spiking, and they're really kind of feeling almost anxious, even panicking, grounding strategies can kind of, get you out of your head a little bit so that you can focus on what's happening next and to get a little bit of clarity about your situation. And so one grounding strategy I like a lot is and basically what grounding is it's just getting back in touch with your senses. It's getting back in touch with your environment so that you can gain a little bit of clarity. So the first step this is called 5, 4, 3, 2, 1. So a lot of numbers today, but the first step is you're going to name 5 things in your environment. So for example, I see my folders, I see a candle, I see a can of soda, I see my pens and pencils, I see paper. The next thing you're going to do is name 4 things that you feel. I feel the air in my skin. I feel the chair underneath me. I feel my feet on the floor. I feel, the hair on top of my head. The next thing you're going to do is name 3 things that you hear. That could be a fan. It could be music playing. It could be the birds chirping. The next thing you're going to do is 2 things that you smell. So maybe you smell your laundry detergent. Maybe you smell air freshener. And then the last one is something that you taste. So maybe you taste your gum or a sip of coffee, and then you take a few moments to breathe in and out. And so this exercise, I know it sounds a little bit wacky, but when you take some time to do it and when you practice it, it really can get you back in touch with your senses so that you can just be able to catch your breath just long enough to figure out your next step. So I'm happy to answer any questions about these as well.
Yeah, all of that's great, Liz. And I just love that Dr. Henny, like you get it, like you get all of these moments, because as you were talking through them, I remember when I had the lesson where they teach how to do injections, and I was lying back, I was wearing a black t-shirt, and when I stood up, the nurse started giggling a little bit because my armpits were like, there's a giant sweat ring around my armpits, just because I'd never done that before, right? And so a lot of this is the first time for so many people doing this. And so, yeah, of course you're nervous. It's the first time I was just reading the chat a little bit, and mixing medications. Nervous about, okay, is this the beginning of my journey, or is this going to just work this first time? And what's that going to cost, right? And there's just so many pieces of this. But I do think the waiting is one of the hardest things. And that idea of being present focused can be really helpful. I often, what I did for myself and what I talk to my clients about is just, what do you know now? Because so often it's, what am I thinking of that happened before? What past trauma is impacting my feelings now and all this, this round or this moment? And then what am I worried about into the future? Those things don't help us, right? But what do I know now? I know that I'm on day 4 of my 2-week wait, and that the transfer went well, and that the embryo was thawed well. It's like just listing, or just really thinking about the information that you have, not that you read online about the percentage chance that a PGT tested embryo has, or not that stuff. Just what you know is that the transfer or the IUI happened on this day and this is where I'm at. And then if you're able to do some of those meditations or mindfulness activities, I think that's really great. If you're not, I do believe in distraction at times. I know that sometimes that's like kind of avoidant, but sometimes you just need to binge watch something that will allow your brain to move away from all of this. Listening to something, I listen to a lot of comedy. I knew every comedy special on Netflix, everything Netflix had to offer in terms of comedy, because you just want to laugh, and you're going like, it's like you have like an advent calendar to beta, right? It's like, what can I, so sometimes you just need to do that. And, really encouraging people to connect with people who they feel really comfortable with. So, you can set it's so hard now with COVID and all that, but even like a Zoom date, or, you have activities, you have things planned, so you have things to kind of look forward to a little bit. And one other thing that I find has been helpful for people is, so much of this is about creating. You want to make a family, right? And sometimes when you just get down to this idea of having something to sort of show for your efforts, almost sometimes can be something that people connect to. And so even like cooking, finding a really good recipe and then going to the market, the process of it, right? Engaging. And I think that's what, when you're talking, Liz, about mindfulness activities, it's one thing to be able to kind of name or smell or, that kind of those activities, which can be really great. Another way to engage all your senses is to do an activity like gardening, right? But just paying attention to what you're doing. Okay, I'm making whatever pasta sauce from scratch, and so I'm going to put this in, and I'm going to smell the herbs before I put it, right? And just kind of like getting into the activity of things, whether it's gardening or cooking or baking, whatever. Crafting, if people are, I worked with somebody and she started making earrings. She started beading. She was like, I've never done this before, but she made the most beautiful earrings. And she was like, oh, and then she would look online and buy different kinds of beads and learned different techniques for doing it. And she was really good at it, but she'd never done it before. But there was this urge to create. And so if you have that as part of yourself, listen to it. And I started doing ceramics at one point also. I was just like, I don't know. And it was great because then you're like, I made a bowl. You feel so proud, and, or even a meal or whatever else. So, I just think it's really, everybody's different. I think one of the slides said that everybody experiences this, has a different lens through which they are understanding and making sense of this journey. And it's important to know what feels right for you. So I think we're throwing a lot of information out there, a lot of possibilities, and being able to pull a couple things and just try them and see if this works for you. Like that's hopefully that's a takeaway from today, that there are a lot of different ways that people go through this, and a lot of different supports. Mindfulness isn't all, sometimes that worked for me. And other times I was like, I don't want to be mindful. I want to be pregnant. So I'm going to bake. And then I'd find a recipe, and that occupied my mind, because you have to do things in an exact way. And that worked. So I think everybody's really different, and just finding what connects for you is important.
I couldn't agree with you more, Maya. And it's not a joke. I can laugh about it now, but when I was at my last transfer and was at the 10-day wait, I thought, okay, I'm going to be mindful. I'm not going to eat chocolates, like my advent calendar of counting the days away. And so I purchased and downloaded a 10-day wait app that was supposed to be mindful and find my Zen. I might have told you the story, Maya. And I turned it on. I had my little my feet are up. I'm in this, namaste moment. And it was this English man's voice with the most posh, obnoxious accent. My phone almost went and hit the wall. Like I was like, how is this man going to tell me? It was just a difficult thing. And I think that really spoke to my soul of like, you know what, you have to find what works for you. So I appreciate everyone's perspective in sharing that, because, you can't, this isn't, we're not, that every journey is different. And so really find like, how do you honor yourself the best? And figure out what's going to soothe your soul, so to speak, to get you through that next moment.
I'm going to throw out something that's a little bit different. We've talked about a lot of things on how to manage your stress. and anxiety and the emotions as you're going through this, all of these positive things that you should do, I kind of want to touch on a few things that maybe you should try to avoid doing to kind of minimize some of that anxiety. And I think the most important thing is minimize comparing yourself to others. Your journey and your experience in life belongs to you and no one else. But it's really easy, I think more so now than it even was 20 years ago with all of the social media out there. Like you see the 52-year-old celebrity who's suddenly pregnant with twins, but you don't necessarily hear what their story was or how that happened for them. And you say, oh, my grandmother got pregnant 8 times with no problem. Why is it difficult for me? Social media, like I will tell my personal story, which was when I was a resident. My first husband left me. And on Christmas, I sat down and I opened up all of these cards that had been sent to me from friends, and everybody got married or had a baby that year. And all I could think of is, instead of, oh, look, I'm doing well and I'm moving forward in my career, it was this whole, I'm a failure. Everyone else is growing their families and I'm not. Okay, now I'm a little emotional, so I should stop that part of it. But it's like avoiding those comparisons, because your journey, your experience is yours, and it's not any less valid than anyone else's. And I really love, I love this picture of this pregnant woman with 6-pack abs. I'm like, I have never seen a pregnant woman with 6-pack abs. It's not real. And so remember, what you look at on social media is like airbrushed and it's made to look really pretty, and nobody shows you. It's very rare that even on social media, your friends are going to tell you about their hard days, but everybody's having hard days. So recognize that it's okay to have your hard day, and don't compare yourself to other people and what they're putting out there for public consumption. And I can't believe I just shared that personal story. So, but it's real. But those are things to avoid. And, so we talk a lot about the things you can do, but I think one of the other things that you can do is avoid certain things. So we're going to sort of change gears a little bit. I want to introduce you to our VP of People. This is Sarah Marsatelli. I had to practice her name earlier because I didn't want to get it wrong. But she wants to, I really think one of the most important things you can do for yourself, this is back to the positives, is knowledge is power. Get your knowledge and then advocate for yourself. And so Sarah is going to talk to you about different things that you can do to advocate for yourself.
Thank you, Dr. Henny, and thank you, everybody. This has been, really, really insightful. I am someone who has gone through my own egg freezing and IVF journey, and so hopefully I can share some insights to all of you about being on both sides of the spectrum, being someone who leads a people operations or HR team, and then someone who's been through that journey as well. And so I think the first thing that is really important to know, that you as an individual can invoke change. And even if it's just one person, there's so many things that you can do to advocate for yourself or other employees, or even on behalf of other employees, to make positive change within your organization. It's really important to find out who to speak to, right? Sometimes, depending on the organization, whether it's big or it's small, it can be really confusing about who to go to. It doesn't necessarily have to be somebody in your people ops or HR team, although that's always helpful. But even, a senior leader or somebody you feel close with, there's great resources that a lot of companies have, such as employee resource groups, where you can find other like-minded individuals who might be going through the same thing as you and can also help be an advocate for you. I think, the second piece of advice I can really, really provide is employers want to offer benefits that their employees are going to use. It's more beneficial for us as the employer to make sure that utilization rates are up and making sure that we're meeting the needs of our employees. And especially, this day and age, with it being such a candidate-driven marketplace, employers are really always looking for ways to attract new talent and bring people in the door. And when employers are offering things like more inclusive benefits, whether it's fertility benefits, whether it's parental leave, whether it's bereavement leave for pregnancy loss, it just creates this goodwill component with your employees, even if they're not necessarily going to use that benefit. And so, I'm constantly thinking about, from the employer side, what can we do to make sure that we're keeping people? What can we do to make sure that we're an employer of choice? How do we ensure that our employees' needs are being met? And so always sort of assessing from the employer side, what are we hearing from our employees? We hear it through different avenues. We hear it from conversations with people. We hear it through survey feedback and data. So if your employer sends any sort of surveys, engagement surveys, benefit surveys, anything of that nature, it's really important to give some honest feedback and say, hey, this might not be working, or I really wish we could have this benefit. And then I think the other thing to really keep in mind is the importance of timing in these discussions. A lot of companies' benefit plan years start on January 1. That's not always the case, but knowing when to have these conversations, bringing data to the conversation, making sure you're giving your employer's people ops team or human resources team enough time to evaluate different needs that might be out there for you. And so really understanding the timing component is really important. But again, I mean, the best thing that you can do is ask, right? Whoever it might be, and really just try to find other people in your circle who might want the same thing, and come to your employer and bring that data and say, this is what would really go a long way, because this is an emotional journey. It's a financial burden on a lot of people. Mental health plays such a big factor here. So when employees don't have to think about those things, when employees can take those stressors out because they know they have, a resource, or they know that they have their employer behind them, they can also be more focused on, not worrying about that at work, being able to focus while they're at work. We all have to work. And so I think, bringing these type of benefits into an organization can really, really help just from a productivity standpoint. And, offering something such as a fertility benefit really goes a long way. I'm happy to chat with anybody if they ever need to talk about how to advocate more. You can always find me on LinkedIn or email me, but I know we are out of time almost, so I'm going to turn it back to Dr. Henney, and she will take it from here. But if anybody has any questions, feel free to send me a note.
So I think really the point that we wanted to make tonight is managing your expectations, not setting expectations that things are going to be simple or easy or that they're supposed to be, and accepting that there's going to be hard days, and accepting that it's okay to have a hard time going through this, and it's okay to ask for help. I love this quote, let your hopes, not your hurts, shape your future, because we all have high hopes. Everybody does have hurts, but if we can let our hopes kind of guide us in our right direction, that's going to be really helpful. I know that Dr. Mayer probably has some input that she would also like to, I feel like I've taken up a lot of your time tonight. So I would love to hear from Dr. Mayer to see if she has pointers on management acceptance, and then maybe even if Maya or Liz have any sort of quick comments that they want to make before we pass things back to Tracy for housekeeping.
Dr. Merrick, are you stuck? I promise I'm not the mute.
I think I could do it now. I tried and I couldn't there for a second. Thank you so much for this. This has been really great to sort of feel like the team's all together rooting for everyone. One thing that I would say too is everybody has to find their own coping strategies, but I think there also should be an acknowledgement that when you're in a situation that is there can be an adjustment process and a grieving that's really intense. And sometimes the right answer for somebody is to take medication. And that can be for a short period of time or for a more extended period of time, but like also normalizing taking anti-anxiety medication or antidepressant medication if that's what needs to happen to keep you functioning through something that can really become sort of too pervasive in the rest of your life because of the thought patterns that are happening that are really hard to, to switch over. So of course, we want to pull in all of our strategies, but sometimes medication also. And just, as much as you can, because we just don't talk enough about fertility and infertility in our society. So as much as you can decide for yourself who your team is going to be and who that support system is going to be, and decide that you're going to disclose to some people that whatever you're going through, and ask and be straightforward about the fact that you may need to lean on those people more than you otherwise would. And people who love you want to be there for you when you're going through something hard. And it can be really hard when you feel isolated in this thing to be open about that. And so, it might not feel like the people that you love understand what's going on, but they can at least be a support and be an ear and be just be there to check in on you too, so you don't have to feel so isolated.
Thank you, Dr. Mayer. I think that's so important. I really want to thank everyone today. And I'm going to give, the reason the housekeeping part is we have some wonderful discounts to offer, and I'd like to get to those before anybody jumps off. And then if there's any additional questions that anyone has, please feel free to put them in the chat. I'm going to give Maya and Liz time to kind of wrap up and give our last moments, but I want to make sure that I give our discount. And something that we talked about is your team. And I always say, let us be your village. And our biggest goal here is to make sure that we're supporting. And a few people had asked about our acupressure session. So these, this code will work for those as well. So it's any of our holistic services. It's something I went through 10 years of infertility treatment. So to say that this type of session is soothing and supportive, and know that why I work with Kindbody is really to bring this inclusive and supportive 360 care to our patients. And so we really have a wonderful group of over 30 providers, both in mental health, somatic movement therapy. We have acupressure. We've got a lot of wonderful services because we're very much committed to caring for the whole you. So know that you can come to Kindbody. And then also additionally, so you have the support discount, Talkspace has offered us. Shadi, I hope you appreciate how quickly I made this slide for you. She gave me this discount maybe 10 minutes before the call, but this is a beautiful discount as well. Our friends at Talkspace are offering a 20% discount for the first month of services. So I'm very proud of that as well. And thank you everyone at Talkspace for mobilizing and being so committed to having this important conversation with us. And then we do accept insurance. So anybody who's here and really want knowledge is power. We've been having incredible AMH events at all of our clinics. It's been so wonderful to meet everyone and see people in person. But just know that you're able to utilize your FSA, your HSA, and we accept a great, wonderful amount of insurances. Again, any questions about anything, feel free to reach out at Navigator at Kindbody. We're always here to ask questions or answer questions. And if you wanted to reach Sarah or had any questions of how to advocate for your employer, you can reach her and email her through that link as well. And if anybody has any additional questions, if anyone wants to chat in the, put anything in the box, please do. But Liz, please, any closing comments you'd like to make, and we'll go to Maya.
Well, I really appreciate having the time to talk with everybody today, and I hope everyone here gives themselves credit for the strength that they've shown so far at finding information and starting this journey, being on this journey. And I also wanted to add that as you go through your journey to create the family that you are hoping for, just remember that joy and pain can coexist at the same time. It's perfectly okay to be disappointed and anxious, and also excited and joyful about the fact that you're doing something to make your family happen. So just wanted to end up on that.
And I guess I'll just wrap it up and thank everybody for being here. And I guess one last thing could be this idea of finding your mantra. And perhaps for some of us, it's just this too shall pass. And just remembering that this moment is a small moment on a very long, lifelong journey of all kinds of different things happening for us. And hopefully the fertility part is a short one, and that you can move through it with as much grace and support and love and all these great things. And just, it's just watching this and seeing all these slides and all the support from Kindbody. It's like, where were y'all 10 years ago, right? It's really amazing to see. And I hope that people utilize the various discounts and just connect with people. Kindbody has a therapist in all the states that they're in, licensed therapists in all the states that they're in. Sounds like Talkspace has very available people as well. And so, you know, I think, and obviously your doctors here really understand the journey and the process. So just, you know, remembering that this will pass, and hopefully Kindbody's here to support.
Thank you, Maya. I see that last question, and Cassie, know that we are going to do an event focused on the partner journey, because that is a huge topic that we're very proud to be able to support. We have a whole new support group with our support system within Kindbody called Kindman that really honors the partner journey, and we're able to support through nutrition, mental health, and a lot of pieces of the puzzle that also really honors our gay male couples at our practice. So please stay tuned, because we will have another a free virtual event to really tackle that, because that needs a whole different deck, I would say, and a bunch of a new time for more conversation. So unless Liz does anything, Maya, Liz, that you could say quickly in that, I know it's a lot to tackle as far as like supporting the partner through the mental health piece. Now they're muted again. Oh no. Look at, you can see, I promise no hands. I didn't touch anybody's mute button. Dr. Henny, do you have any suggestions?
I think it's just important for the male partners to understand that it's okay for them too. I think sometimes it's really hard for men to do a fertility assessment because there's a machismo. It affects their ego to think that they could have an issue that makes conception difficult. And so sometimes it's just making sure that they know that even if there's an issue, that they're still just as much as a man today as they were yesterday. But I also think it's important to include the men on these conversations so that they don't think they're the only person stressed out in this. They can go through this, they can be part of your support system while you're part of their support system.
Thank you so much. Well, thank you, everyone. I know we went a little bit of over in time. My East Coast friends, you're probably ready to go nine-eye. West Coast friends are starving. My husband is in the background like, are you done yet? Are you done yet? Can we eat?
Can I chime in one real quick thing? I saw.
Please.
So this is unrelated to the mental health, but that somebody asked about how to connect with Kindbody if they are in a state where Kindbody is not located. And I just wanted to point out that we do have virtual assessments available. And after your virtual assessment, we can help connect you with one of our Kindbody partner clinics that may be closer to you.
Perfect. I was trying to type that in the chat and mute Maya, because that's clearly what I've done this entire event. Sarah, thank you. Liz, thank you. All of our friends at Talkspace India, thank you so much for jumping in chat. I know it was a last minute jump in, and what I really appreciate, there are many of our Kindbody team members hiding in the wings. I'm not going to call you out right now because you probably have your cameras off, but I want to thank everyone for joining and being part of this conversation. Dr. Henny and Dr. Mayer, I really appreciate both of you for being part of this. And I can't wait till we get together soon. There will be a recording of this on our YouTube channel in the next few days. But just know, again, any questions, if you lost the discount code, you're not really sure, or if there was information, additional information you were interested in, please email us at navigator@kindbody.com. So thank you so much. Have a wonderful evening, and we hope to see you soon. Thank you.